Hello, and welcome to the volunteer orientation for St. Luke's Free Medical Clinic. This is our building located on Dean Street off of East Main, right behind First Baptist Church. The mission at St. Luke's is to change the lives of underserved Spartanburg County residents by providing quality and compassionate health care. We believe that all individuals deserve access to quality medical care, regardless of their ability to pay for it. A little bit about our history. Reverend Dr. Clay Turner and Reverend Benjamin Stoddy began talking with local physicians. They then formed a committee of 30 doctors who came together looking for funding and a location. Mount Moriah Baptist Church graciously donated a location on their campus rent-free, and the doors opened to St. Luke's in August of 1992. We then outgrew Mount Moriah's building, and descendants of John B. Cleveland donated the old Georgia Cleveland home. This is the building we're in now, and it was built in 1907 and acted as Spartanburg's first hospital until 1921. John B. Cleveland then purchased the building and turned it into the Georgia Cleveland Home for elderly women, and then it became St. Luke's in 2001. Here at the clinic, we provide primary care on site. We also have a pharmacy on site. We do referrals for specialized care to over 100 referral physicians out in the community. And we also, Spartanburg Regional Healthcare System also provides a lot of services to our patients free of charge. We have some specialty doctors that come on site, such as dermatology and GYN. We have comprehensive health education and preventative programs. We have an on-staff dietitian that sees patients one-on-one for coaching in diet and exercise. And then we have a more intensive program for our patients with uncontrolled diabetes and hypertension. They see a PharmD consultant for medication therapy management alongside the dietitian over the course of a year. We also have mental health counseling here on site. We have a staff counselor and a volunteer counselor, and we also have a provider who specializes in prescribing psychiatric medications. In order to be a patient at St. Luke's, you have to live in Spartanburg County. You can't have any type of medical insurance and not be eligible for Medicaid or Medicare. And you have to have a household income at or below 200% of the federal poverty guideline. Most of our patients are treated for chronic illnesses such as diabetes and hypertension. Here on the right, you can see a breakdown of our demographics. Our Hispanic population in particular has grown exponentially in the past couple of years, and we have hired an on-staff Spanish translator to help meet the needs of our Spanish-speaking community members. Falling through the cracks in our healthcare system are the low-income population, members of which do not qualify for Medicaid or Medicare and cannot afford marketplace rates because they are extremely expensive. 16% of Spartanburg County adult residents are still uninsured. That's over 27,000 people. And 15% of Spartanburg ER discharges are for non-emergency conditions. And that's because if you don't have a medical home, you might use the emergency room, which is costly for everybody involved. Or you just don't go to the doctor at all, and then it truly becomes an emergency. Some fast facts about us. The value of our direct and indirect services is a little over $14 million, and our budget is only actually about $1 million. This translates to a value of investment of $1 donated to St. Luke's provides $17 in services to St. Luke's patients. And this is because all of the services provided by our volunteer physicians, both at the clinic and in their offices, all of the services that Spartanburg Regional Healthcare System provides, and all the prescriptions provided through our partner nonprofit, Well Vista, and prescription assistance programs. We rely heavily on volunteers. We have over 150 clinical and administrative volunteers. We only have one on-staff provider, and the rest of our providers are volunteers. My impact is the new system that we just started using. And if you're a student, then you've already filled out an application and have a profile through our system. You can sign up for shifts through the system and it will track your hours. It's really important that you fill out your volunteer forms, and that is located, if you go to your profile and then go under my profile and then go to trainings, you'll see the volunteer forms right here. In order to sign up for shifts, you go to opportunities, go to opportunity calendar, and you can sign up for shifts here. First, your calendar will be blank until you're approved to be able to sign up for like chart room or vital shifts, and then it will look something similar to this. If you aren't signing up for regular shifts, if you have a specific physician volunteer schedule that you need to log hours for, then you'll pick your activity, most likely staff assistant, and then you'll enter in the date and the number of hours you volunteered. So there is a way to subscribe to email reminders and sync it with your calendar to make things really easy. Scheduling, so you can be assigned to a regular shift if we have a position open, but as I showed you, you can just pick up shifts from the calendar as well. If you're unable to come, it's really important that you contact us ahead of time. Most shifts can only be dropped in the system until the Thursday the previous week before your shift. So after that time, please contact us to drop a shift. Please only cancel for emergencies or if you're sick. And if you'll be late, please also notify us. We really count on you to serve our patients. Parking. So this is a map of our parking right here. This is our building. There's parking directly behind our building. Sometimes that can get a little busy, so there's some more parking here on the side, and then in the First Baptist lot directly behind ours. It is really important that you use the front entrance only unless you are handicapped. You can use the back entrance if you're handicapped, and you'll need to be buzzed in because it is key card access only. So please use the front entrance. You can use the back entrance when leaving. As I mentioned, your hours will be logged automatically and you're signed up for a shift in our system. If you are scheduled during one of our evening clinics, food is donated by church groups or restaurants that you're welcome to partake in. Dress code, so is business casual or scrubs, no open-toed shoes on the clinic floor, and no strong smelling perfumes or colognes on the clinic floor. Our emergency procedures, so in case of a fire, obviously get out of the building. We evacuate immediately to the First Baptist parking lot behind the building. In case of a threat, if you're working at the front desk, there is a silent alarm. So you can always dial 911 and then contact our executive director. In case of a tornado, we proceed to the basement. And if the elevator stops, if you have an elevator emergency, there is a phone in the elevator if you don't happen to have your cell phone on you. Right now, we're not currently requiring masks, but if you feel more comfortable wearing one, please do so. If you're experiencing COVID-19 symptoms, been exposed, or waiting for results, please do not come in. Just give us a call and let us know. So HIPAA is the Health Insurance Portability and Accountability Act that protects our patients' privacy. There is a form in your volunteer form section that you can read more about this and you'll need to sign. So our volunteer positions, we have a front desk assistant position. We have a staff member that is there full-time, but during some of the really busy times, you could always use some help. Vitals room, you must have prior experience taking vitals or be a VCOM student in order to be qualified to work and be trained in our vitals room. Chart room, this is a really important position. We still use paper charts for the most part. We do have an EMR system that we use in tandem with the paper charts, but it is mostly paper charts that we need help filing, pulling, stuffing, and organizing for the providers. Interpreters, sometimes we'll need interpreters to help patients during their appointments and for answering the Spanish line. We have various data collection projects that you could help with, such as patient demographics and surveys. We also have a position for social media content creation for Instagram, Facebook, and TikTok. Lastly, please help us spread the word. We are a 501c3 nonprofit, and we get all of our funding from individuals, corporations, foundations out in the community. We're not federally funded, so we count on the community to help support this organization. So please spread the word about us and help spread awareness about our cause. You can follow us on Facebook, Instagram, or TikTok. Thank you so much for listening, and we are so excited to have you start volunteering with us.